everyone. September is Ovarian Cancer Awareness Month, something that is very near and dear to my heart. When I was 18 years old, I lost my mom to ovarian cancer, and the scariest thing is that she was 42 years old when she was diagnosed and passed away at the age of 45. So it's important to me that we bring awareness, especially during the month of September, as it is Ovarian Cancer Awareness Month. I'm joined now by Dr. Theresa Christie. She's from Southern Women's OBGYN over at Trinity Hospital. Thank you so much for being here.
You're welcome. Thanks
I really appreciate you joining me to help bring awareness in this cause. As you know, obviously it's very important to me, and I just really feel that it's important that women know the signs and symptoms so that they're aware.
Absolutely.
So, Dr. Christie, ovarian cancer is known, it's often coined as the silent killer.
Right.
Why is that?
It's called the silent killer because the symptoms for ovarian cancer are very vague. Mm-hmm. There's no specific symptom. You know, you break a wrist, you have pain, people know that you broke your wrist. Mm-hmm. With ovarian cancer, there's no specific symptom where you can say, oh my God, that's ovarian cancer. Mm-hmm. And so very, very non-specific symptoms.
Well, and that's what I say. That's the scariest part, because, right, like you said, sometimes when you're hurting, it's obvious what it is, and these right signs are quote unquote almost normal. So, right, for example, you have bloating, which, you know, maybe you have a stomach ache, but sometimes that stomach ache is really something much bigger, much deeper.
Exactly.
So let's go over some of the signs and symptoms so that people know, hey, if I have this and it persists, then maybe I should get it checked out.
So some of the symptoms can be associated, like you said, with your stomach, obviously. If you feel like you're getting full faster than you have in the past when you're eating a meal, if you have abdominal bloating, if your pant size feel like it's getting a little bit bigger but you don't feel like you're gaining weight, if there's some increased size in your stomach, just general vague abdominal pain or discomfort, and pretty much that's about it until you get into the more advanced stages of the disease. Which
then you could start feeling maybe nauseous or nauseated. And again, I mean, all the signs and symptoms that you've gone over are those that maybe affect women on a daily basis.
Absolutely.
And so while I don't want to scare people, I just want them to be proactive about their health.
Exactly.
I think that's probably one of the most important things that we as women can do for ourselves.
Absolutely.
I don't know if a lot of people know this, but it is the 4th most common cancer in women.
Right.
What is the best way to detect in terms of testing?
The best way really is by having a pelvic exam. Annually, women come in, they have their pelvic exam. During that exam, we can feel if the ovaries are enlarged, if there's any suggestion of something in the pelvis, which is the most common place where the ovarian cancer, when it spreads, it's going to spread in the pelvis first. And so those are the kinds of things. If we feel something like that, then we can get an ultrasound or do further testing if there's anything that we can feel.
And I have to point this out because a lot of people think that those exams are specifically to detect ovarian cancer, but that's not true.
That's not true.
So fill us in on that.
The pelvic exam, many women feel that when they have a pelvic exam that they're getting a pap smear. Okay, so the pap smear is done during a pelvic exam to detect cervical cancer. There's nothing, the only thing that we do during the pelvic exam to detect ovarian cancer is feeling the ovaries and feeling inside of the pelvis. And so there's also a misperception out there that if you've had a hysterectomy that you don't need to see your gynecologist any longer because you don't need a pap smear, but that's not true because there's other things that can happen like ovarian cancer that can be detected during that exam.
And so I just want people to be really aware of that because they think, okay, I'm good to go, we can check that one off, but that's not true. And so I think that, again, being proactive, going in if you sense something, there's several things that I've done too. I've taken the BRCA test, I believe that's what it's called. And so just to know whether or not I carry the gene as well, you can do that. I also have gotten transvaginal ultrasounds just to be extra proactive because of the history that my mom has.
Right, but those are not good screening tests. You know, the BRCA test is good if it's positive. Because then it's an indication that you're at increased risk. But not everybody that gets ovarian cancer is BRCA positive.
Exactly. And so those are just ways to maybe help ease a little bit of that maybe fear of it if it is in your history. But again, I feel like it's important. You know your body.
Right.
And so listen to your body.
And have that discussion with your doctor.
Exactly.
What are your concerns?
What can I do?
What can I do? What are the things that I should be proactive about doing?
Exactly.
Given a family history, that could trigger testing like the BRCA testing or CA-125 testing or something like that.
And so if we do sense something, who could we come see at Trinity Hospital?
Well, you can certainly come and see me. I would be more than happy to evaluate anybody to see if that's what's going on. I have a partner, Dr. Jennifer Patchett also, who is very good at what she does, and we would be more than happy to see you.
Okay, well, thank you, Dr. Christie, for being here, but stay right there because when we come back, we'll be sitting down with her again to talk about a few more things. We'll be right back. Hey there, welcome back. We are in the studio with Dr. Theresa Christie of Southern Women's OBGYN over at Trinity Hospital, and we are bringing awareness today of ovarian cancer because September is Ovarian Cancer Awareness Month. So thank you again for being here. We just talked about in the first segment how ovarian cancer is known as the silent killer. It's very hard to detect. Why is it important for women to be proactive about their health?
Well, things like ovarian cancer can be detected on an ongoing basis when you have a relationship with your doctor. You've seen your doctor on a regular basis. They can detect subtle changes in your exam, and those are the ways that we can detect something like ovarian cancer. Colon cancer, which is more common than ovarian cancer, can also be detected during those exams.
And I think the most important thing too for me is that it could potentially save your life.
Absolutely.
If you detect it early enough, it's something where you can get treated and hopefully, God willing, prevent further or bigger damages.
Right. Since there's no way to detect a precancerous state, the idea of detecting something in the earliest possible stage gives you the greatest survivability of it.
Yep. And I know that we went over the symptoms, but just in case somebody is just tuning in, let's go over those symptoms again, because I feel that, again, we talked about how quote-unquote normal they are. Tell us what those potential symptoms could be.
So the symptoms of ovarian cancer can be related to mostly just abdominal discomfort, abdominal swelling, early satiety when you're eating, even some, just reflux that you haven't had before, bloating, increase in your abdominal girth, if you have to all of a sudden wear a bigger size pants but you haven't really gained any weight specifically.
And again, I don't want to put fear in people, but I think that it's always important to listen to your body. You, I think, know your body. As women, we know our body better than other people do because it's affecting us, and so we feel those changes. And if you do feel those changes, it's important to act on them. Come see somebody like Dr. Christie so that you can put your mind at ease. I think that's the most important thing. And again, for example, with my mom, it was gas, and I think when she went to go get checked out, they were persistent on it's gas, it's gas, it's gas. What are your opinions on getting a second opinion?
A second opinion is never wrong. It's important to be able to talk to somebody who's going to listen to your symptoms and take you seriously. There's nothing wrong with a patient who has some symptoms, probably vague, getting an ultrasound just to take a look and make sure, and allaying their fear as well. And so second opinion is certainly not something I'm afraid of in my patients. If they want a second opinion, I tell them go ahead.
And that's, for me, because of the history, that's something that I took action on. I get the ultrasounds, the transvaginal ultrasounds as well, and it can be a little invasive, but for me, again, it's about being proactive and potentially saving, my life.
Absolutely.
So thank you again, Dr. Christie, for being here, for bringing awareness to ovarian cancer, and we hope that women will be proactive, right?
Absolutely.
Well, again, if you need any more information, you can go to AugustaMedicalProfessionals.com, click on their specialty, which is OBGYN. Thank you again. And if you need more information on them, you can go to thedishon6.com as well, or if you want to revisit any segment, you can do so on thedishon6.com.